Brings us to 20 to 2 this afternoon. Let's shift gears, bring you some good news. One of the biggest public hospitals on the continent has opened a new burns unit, Hani Baragwanath Academic Hospital in Soweto, unveiling a state-of-the-art Roy McAlphine Burns Unit costing an estimated 100 million rand to build. Let's unpack this story. What does it mean for the hospital and I suppose for the community and even further than that? We're joined now by the head of the burns unit, Professor Adelin Muganza. It's great to talk to you, Prof. Thanks very much indeed for coming on to the program. You must be incredibly excited, Prof.
Yeah, thank you very much for hosting me first. And we are very excited as staff of the Hani Baragwanath Burns Center. And we think that we're going to see a good light now.
Just to be clear, Professor Muganza, Hani Baragwanath did have a burns unit, right? These are now additional specializations, additional rooms, additional beds. It's an upgrade, essentially.
Yes, you're right. The Burns Center was established in 1991. It's already 33 years, but we had some challenges in terms of number of beds, in terms of operating time. And that's why the donation came in. In fact, it is a partnership between the donation, the Roy McAlphine Foundation, the Wits University, and the government. So it is an extension of the burns unit.
Right. And when you talk about, previously what the challenges would have been, Prof, a big part of that would have been resources, right? For example, the number of beds and the fact that it was limited.
That's right. So we are a high-volume center and has the only functioning public sector burns unit. And the demand of admission was very, very high, especially during winter. We're working like a disaster situation. So the number of beds, especially the intensive care bed, because large burn needs intensive care management, and the operating time was as well a little bit a problem because, these patients sometimes they need 4 to 5 operations before the full healing of the wound. So we didn't have that access to operating room all the time.
Yeah. It's certainly something that's not only going to improve the service for the community in Soweto, where the hospital is based, or even just for Johannesburg or Gauteng. It's really a regional hospital. Would you say, Prof, even on the continent?
Yes, absolutely. I mean, this is the large advanced burn center on the continent. I would say that it is among the best burn center in the world, because if you look at the number and the expertise that we have in here, the multidisciplinary expertise that we have. So besides the service, as you said, we are an academic institution. We do education and training, and that's where we focus most in terms of research and innovations. And we try to help as well some other, besides the institution in South Africa, we helping as well other African countries in terms of training and education.
Yeah.
In fact, in the past already, we have a track record of helping some of these countries. Like the first burn center was established in Malawi. So we did train them and they spent time with us.
Yeah.
So it's an ongoing process. It will be much improved compared to last time compared to the past. Yes.
Yeah, and as it stands, I mean, the unit, even before this work was done, treating tens of thousands of patients. Prof, perhaps as we end off our discussion, also perhaps just as an aside, we had 2 major burns disasters just in the past few months in Johannesburg. Just shows how critical a unit of this nature is. But why is a burn injury so specific in the way that it is treated, Professor Muganza?
Yes, burns need advanced treatment that many people don't know. And you need many people involved. You need the surgeons, plastic surgeons, psychologists, psychiatrists sometimes, physiotherapists, OT, nutritionists. All those people can be involved in just for one patient. And that's why we said it is an advanced treatment. And but the bottom line, we need to prevent burns to happen because it's quite expensive to treat burns, and many of the burns are preventable.
Yeah.
You mentioned about the disaster. I think this unit in the future will be able to deal with a major disaster. I'm aware of those disasters last year, 2 of them, big one. And even this week we had some burning building in town. We managed to take 2 patients from there. But I think the service would be much better.